great taste of trail mix. It's sure to wake up the trailblazer in you. But the trail starts here.
Healing the American healthcare system.
Then my doctor told me about
By Annette Buchanan Phillips. There is a market for healthcare, which includes every American. Every human being will need healthcare during their lifetime. That fact constitutes universal demand. Constitutes universal demand. The medical profession, pharmacological interests, and insurers are the supply side of the healthcare market. With universal demands comes a high price for services. This fact is the basis of the healthcare economic problem. The benefits of excellent healthcare seem outweighed at times by the high marginal costs of performance in the form of malpractice premiums and capital equipment. Constant advances in medical research and development of state-of-the-art diagnostic tools make American healthcare services rendered among the best in the world. However, this primary care is not available to all Americans. The cost of denying universal coverage is greater than guaranteeing it. A comprehensive health care program is an idea whose time has come. Healthcare is not a manufactured good with a household factor. Most consumers do not contribute now to the industry, but universal consumption exists before birth. That consumption does not end until after death. Yet the medical providers are themselves a constraint. There are simply not enough doctors to make the demand for health care less than the supply. By controlling upfront costs of providing health care and spurring competition among insurers, alternatives to the current system may emerge. Forming a group of the uninsured may provide the opportunity that some Americans need for low-cost primary health care. Mrs. Hillary Rodham Clinton, senator now, at the time this paper was written, I believe she was First Lady. Now, anyway, she believes that universal coverage is possible and wants to control costs. Mr. William Miscannon, chairman of the Cato Institute, disagrees with her premise. These two speeches gave opposing viewpoints on the health care question. Perhaps one could debate the need for prenatal care, diagnostic equipment, preventative medicine, and or death certification by a physician. Whatever the question for debate, the need for medical attention and services continues to exist, and debate has not changed the system in a real way thus far. All medical services are of value, as are all the consumers of those services. The amount of self-paid health insurance premiums that are deductible is so small that very few can qualify. Medicare requires a copay insurer, and Medicaid is for women with dependent children who are unable to work. For 6 months of the year, women without children and single men or couples have nothing in the form of Medicaid. Companies that pay minimum wage provide no health insurance. Some companies self-insure. So please don't get sick or you'll lose your job. Most people can't afford to obtain insurance if they could get it. Most can't get it because they are not a corporation and therefore a group. What's wrong with this picture? It's a maze, not amazing. Your classic catch-22. The never-ending medical procurement saga whose morals has eluded Miss Cannon, let me say that again. The never-ending medical procurement saga whose moral has eluded Miss Cannon actually is that he's not in touch with reality. Miss Cannon believes that doctors hike the price of services in order to get more money from the honeypot. He has outpriced malpractice. He has not priced malpractice insurance. Perhaps his energy would accomplish more in the direction of malpractice suit award caps or insurance rate caps for high-risk specialists that discourage students from such aspirations. Maybe he would like to raise money to educate more physician's assistants and doctors and equip them in the rural areas. Those could be real avenues of thought for him, as well as Republicans, insurers who don't want more regulations, and businesses who don't want to provide their employees with them. Insurance coverage, that is. Voluntary participation in a not-for-profit corporation of uninsured Americans may be the alternative that we seek. At $5 a week or so, I'd join. And see, this paper was written in my undergrad, 1995. So, Mrs. Clinton is correct in outlining the problems that are obstacles to universal coverage, but her speech barely broached the subject. She does not specify in detail her specific plan to alleviate the condition of American health care. My plan is what I said before. For $5 a week or slightly higher, any American can join a not-for-profit group for the sole purpose of self-insurance. And with the premiums that would generate, shop among commercial providers for a comprehensive plan. We all know that they invest the premiums, that is, the insurance providers, the commercial ones. They don't sit on the premiums at 3% in some savings account. Perhaps politicians think that we are from some other planet. If they wanted to insure us all, then they'd do it. Therefore, it must be more profitable for them not to do it. And that's why we don't have health insurance for millions of Americans. Now, to amend that, in an economics paper, I suggested that what we might want to do is underwrite our healthcare cooperative venture, if you want to call it that. I'm full of cooperatives these days. Is that if we underwrite it with something like that employers have to pay or are required to pay, such as the Bureau of Workmen's Compensation's premiums, then we could set aside perhaps 50% of that allotment, 25% of that allotment to underwrite our national health care program. Or we could make it a grant opportunity for faith-based organizations across the country to insure their membership who are uninsured. Surely we could find a way if we really wanted to.